The headache started in August, sharp and sudden like someone driving a spike through my skull. By September they were daily. By October I was experiencing vision problems. Double vision, blind spots, moments where everything went dark. It's probably just migraines, my mother said when I mentioned it at Sunday dinner. She was a nursing supervisor at County General Hospital, 20 years in healthcare. You're stressed. Take some ibuprofen. My brother Kevin nodded. Mom's right. You always overthink health stuff. Just stress headaches. I was 28, a software engineer for a tech startup, and I knew something was wrong. Mom, I'm having vision problems. That's not normal. Lots of migraines cause visual disturbances. It's called migraine with aura. Very common. You're catastrophizing again, Sarah. I've never had migraines before. Well, you're getting older. Your body changes. Welcome to your late 20s. My father, who worked in hospital administration at the same facility, barely looked up. Your mother's the medical expert. If she says it's migraines, it's migraines. I left dinner with my head pounding. The next week I collapsed at work during a team meeting. One moment I was presenting code architecture, the next I was on the floor seizing. I woke up in the emergency room at Metropolitan Medical Center. A neurologist, Dr. Elena Rodriguez, sat beside my bed. Sarah, you had a seizure. We've done an emergency CT scan and there's a mass in your brain. A significant one. We need an MRI immediately. A mass? Like a tumor. That's what I'm concerned about. Based on the location and your symptoms. Headaches, vision problems, now the seizure. This needs immediate attention. The MRI confirmed it. A 4-centimeter tumor in my left temporal lobe. The biopsy would determine if it was malignant. But regardless, it needed removal soon. My neurosurgeon, Dr. James Mitchell, was one of the top specialists in the region. Sarah, this tumor is causing increased intracranial pressure. Whether benign or malignant, we need to remove it. The surgery is complex. It's near critical brain structures. But I've done hundreds of these. We're scheduling you for surgery in 2 weeks. 2 weeks. Is that safe? It's the earliest we can get you in. We can't wait much longer. The seizures will worsen and there's risk of permanent brain damage if we delay. I called my mother from the hospital. Mom, I collapsed at work. I had a seizure. They found a brain tumor. I need surgery in 2 weeks. Long pause. A brain tumor? That seems very dramatic, Sarah. Are you sure these doctors know what they're talking about? Sometimes ER physicians see things on scans and jump to worst-case conclusions. Mom, I've had an MRI. There's a 4-centimeter mass in my brain. I'm having a biopsy tomorrow. 4 centimeters seems large for something that just appeared. Are you sure you didn't just have a panic attack? Panic attacks can cause seizure-like symptoms. The neurologist said it's definitely a tumor. The neurosurgeon said it needs to come out immediately. Who's your neurosurgeon? Dr. James Mitchell. Pause. From Metropolitan Medical? Yes. Another pause. Well, I suppose he's competent. But brain surgery seems extreme for what's probably just a small benign growth. Have you considered monitoring it? Surgery has risks. Dr. Mitchell said the tumor is causing dangerous pressure. I could have permanent damage if we don't remove it. Neurosurgeons always want to operate. That's how they make their money. I really think you should get a second opinion. And honestly, the timing is terrible. Thanksgiving is in 3 weeks and we're hosting. I've invited 15 people. We need you there to help set up. Mom, I have a brain tumor. I'm having surgery. And you'll probably be fine by Thanksgiving. Brain surgery recovery isn't that long for minor procedures. Just schedule it so you're recovered in time. We're doing dinner at 2 and I need you there by noon. This isn't a minor procedure. You're being dramatic. People have brain surgery all the time and go back to work in days. Just don't use this as an excuse to get out of family obligations. Kevin called an hour later. So Mom says you're having some minor brain procedure? You'll be fine for Thanksgiving, right? I'm bringing my new girlfriend and Mom's making a huge deal about everything being perfect. Kevin, I have a brain tumor. I'm having major surgery. Yeah, but it's not like cancer, right? Just something they need to take out. Don't make this into a bigger deal than it is. The biopsy showed the tumor was a grade 2 astrocytoma. Not the worst type of brain cancer, but still cancer. Slow growing but would eventually become aggressive if not removed. The surgery was scheduled for November 18th, 5 days before Thanksgiving. Dr. Mitchell was frank about risks. This is delicate surgery. The tumor is near your language and memory centers. I'm confident I can remove it safely, but there's always risk. Stroke, infection, permanent neurological damage. You'll be in ICU at least 2 days post-op, then regular hospital stay for another 3 to 5 days. Full recovery takes months. My family thinks I'll be fine by Thanksgiving. His eyebrows rose. Thanksgiving is 5 days after your surgery. You'll still be in the hospital. Even after discharge, you'll need complete rest for weeks. They think I'm being dramatic. About brain cancer? My mother's a nurse. She thinks it's a minor procedure. Dr. Mitchell's expression darkened. My mother called twice before surgery. Once to ask if I'd confirmed I'd be at Thanksgiving. Once to tell me she'd invited colleagues from County General to dinner and didn't want me embarrassing the family by talking about medical stuff. I'll be in the hospital on Thanksgiving. Don't be ridiculous. They'll discharge you by then. Just tell them you need to leave. Mom, I'm having major brain surgery. I'll be in ICU. You're so negative. That attitude will make your recovery harder. You need to be positive. Mind over matter. I had the surgery on November 18th. Dr. Mitchell said it took 7 hours. Longer than expected because the tumor was more invasive than scans showed. But he'd removed it completely, clean margins, no apparent damage to surrounding tissue. I woke up in ICU with my head wrapped in bandages, a drainage tube coming out of my skull and pain medication making everything fuzzy. My friend Rachel was there holding my hand. She'd taken a week off work to be with me. Where's your family? The ICU nurse asked. Planning Thanksgiving, Rachel said, her voice tight with anger. I spent 3 days in ICU. The headaches were excruciating despite pain medication. I couldn't walk without help. I couldn't focus my eyes properly. But I was alive and Dr. Mitchell was pleased with my progress. On day 4 I was moved to a regular room. My mother finally called. So, how did the procedure go? It took 7 hours. The tumor was more extensive than they thought. But Dr. Mitchell got it all. 7 hours seems excessive. Are you sure he knew what he was doing? He saved my life, Mom. Well, good. So you'll be discharged tomorrow, right? Thanksgiving is the day after that. I need you there by noon. I'm not coming to Thanksgiving. I just had major brain surgery. I can barely walk. Don't be so dramatic. You're talking fine. You can walk. You're just feeling sorry for yourself. Plenty of people have surgery and still show up for family obligations. This is a really important dinner for me. I have colleagues coming. I have a drainage tube in my head. So take it out before you come. Look, I'm not going to argue. You're coming to Thanksgiving. We're family. Family shows up. I hung up. Dr. Mitchell discharged me on November 22nd, the day before Thanksgiving, with strict orders. Complete bed rest, no physical activity, no stress, follow-up in 1 week. Rachel took me to her apartment because I couldn't be alone. My mother sent 12 texts demanding to know when I'd be arriving. When I didn't respond, she called Rachel's phone. Put Sarah on the phone. Rachel looked at me. I shook my head. She's resting. She just had brain surgery. I know that. Which is why I need her to confirm what time she's coming tomorrow. She's not coming. She can barely get out of bed. That's absurd. Tell her to stop being lazy and get over here. She's not getting out of it by pretending to be sicker than she is. She has a drain in her head. And I work with patients who have drains all the time. They manage fine. Sarah's just milking this for attention. Put her on the phone right now. Rachel hung up. Thanksgiving afternoon, I was lying on Rachel's couch trying to keep down soup when my phone exploded with messages. Not from my mother, from my Aunt Linda, my cousin Beth, and several family friends. The messages were all similar. I can't believe what your mother just said about you. What happened? I asked Rachel. She pulled up her laptop. Someone had live-streamed my family's Thanksgiving dinner on social media. Not intentionally. My mother's colleague, Dr. Patricia Chen, had been doing a Facebook Live showing the beautiful spread, and the camera had caught everything, including my mother's speech. I want to thank everyone for coming, my mother was saying, wine glass in hand. It's wonderful to have our County General family here. I'm sorry my daughter Sarah couldn't join us. He's always been a bit dramatic about health issues. She had a minor medical procedure this week and has decided to use it as an excuse to skip family obligations. You know how young people are, always looking for attention. Several guests nodded sympathetically. What kind of procedure? Someone asked. Oh, just a small thing. They removed some benign tissue from her head. Routine outpatient stuff, really. But she's acting like it's some major ordeal. I tried to explain that recovery is mostly mental. You just have to decide to be fine and power through. But she's always been weak-willed about discomfort. Dr. Chen's camera caught everything. And then, at exactly that moment, someone rang the doorbell. My mother opened it and the live stream captured her face going white. Dr. James Mitchell stood on the doorstep, still in his suit from a medical conference he'd attended that morning. He was holding a folder. Mrs. Thompson? I'm Dr. James Mitchell, your daughter Sarah's neurosurgeon. I believe we need to have a conversation. The live stream showed everyone in the dining room going silent. I'm hosting Thanksgiving dinner. This isn't an appropriate time. You just told a room full of people that your daughter had a minor medical procedure to remove benign tissue, and that recovery is mostly mental. Is that what you believe? Who told you where I live? Your daughter's medical records list you as emergency contact. I came here to discuss her post-operative care because you haven't returned any of my calls. But I have to say I'm shocked by what I just heard. This is a private family dinner. Your daughter had a 7-hour craniotomy to remove a grade 2 astrocytoma. That's brain cancer, Mrs. Thompson. She had major neurosurgery 5 days ago. She currently has an external ventricular drain to prevent brain swelling. She can barely walk. She's at significant risk for stroke, seizures, and infection. And you called it minor outpatient stuff? The room was dead silent. Dr. Chen's phone was still recording, the video now being shared in real time across social media. I didn't realize. My mother started. You're a nursing supervisor. You've been in healthcare for 20 years. You understand what a craniotomy is. You understand what brain cancer means. But you chose to minimize your daughter's surgery to your colleagues and accuse her of being dramatic and weak-willed. Why? She's always exaggerated health problems. She had a brain tumor the size of a golf ball. She had major surgery where I cut into her skull and removed cancerous tissue from her brain. There's nothing exaggerated about that. And the fact that you're hosting a dinner party while your daughter recovers alone is disgraceful. Dr. Patricia Chin stepped forward, still holding her phone. You told us it was minor. You said she was fine. Because she's always seeking attention. My mother snapped. Everything is a crisis with Sarah. A headache becomes a brain tumor. A small procedure becomes major surgery. She does this for sympathy. Dr. Mitchell opened his folder and pulled out papers. These are your daughter's surgical photos. Would you like me to show your guests what minor outpatient stuff actually looks like? Here's the incision. Here's the exposed brain tissue. Here's the tumor I removed. Here's the drain that's currently keeping her alive. He started passing the photos around. Several guests looked physically ill. You had no right. I had every right to correct dangerous medical misinformation being spread by a healthcare professional. You're a nursing supervisor. You hold a position of medical authority. And you just told a room full of people that brain cancer surgery is minor, and recovery is mostly mental. If you believe that about your own daughter, what are you telling patients at your hospital? The live stream ended there. Dr. Chin had stopped recording. But the damage was done. The video had been shared over 10,000 times. People were tagging County General Hospital. Comments flooded in calling my mother heartless, and demanding investigation into her patient care standards. My phone rang. Dr. Mitchell. Sarah, I'm so sorry. I didn't know she was live streaming. I just couldn't stay silent after what I heard. Are you okay? I'm okay. Thank you for defending me. You're my patient. You almost died on my operating table because that tumor was worse than we expected. And your mother called it minor. That's not just wrong, it's dangerous. The fallout was swift. By Friday morning, County General Hospital had placed my mother on administrative leave pending investigation into her concerning statements about minimizing serious medical conditions. The video had gone viral, over 1 million views by Saturday. My mother called once, screaming that I'd ruined her career by telling lies to my surgeon. I didn't answer. Kevin sent one text, way to make Thanksgiving all about you. Mom's devastated. Rachel showed me the social media response. Thousands of comments from people sharing stories of family members dismissing serious illnesses. Messages of support. Donations to brain cancer research in my name. Dr. Mitchell called with updates on my recovery. The drain could come out in a few days. Healing was progressing well. He also mentioned he'd been contacted by the state nursing board about my mother's case. What happens to her? I asked. That's not for me to decide. But when a nursing supervisor publicly states that brain cancer surgery is minor and recovery is mostly mental, it raises legitimate questions about her clinical judgment. The investigation concluded in January. The nursing board found that my mother had demonstrated serious lapse in medical knowledge and concerning dismissal of patient suffering, inconsistent with nursing standards. Her license was suspended for 6 months. She was required to complete remedial training in patient assessment and empathy, and she was terminated from County General. She blamed me entirely. So did Kevin. So did my father, who'd said nothing during the entire ordeal. I underwent follow-up scans every 3 months. No recurrence. Dr. Mitchell remained optimistic. I returned to work part-time in February, full-time by March. Rachel became more than my friend. She became my sister in every way that mattered. I'm 30 now, 18 months post-surgery. My scans remain clear. My hair grew back over the scar. I still get headaches sometimes, but they're manageable. My mother tried to contact me once after her license was reinstated. She wanted to talk about what happened, and suggested I owe her an apology for telling lies that destroyed her career. I blocked her number. Dr. Mitchell still sends me updates about brain tumor research. Rachel throws me an annual Still Here party on my surgery anniversary. My family sends nothing. That Thanksgiving livestream still circulates online sometimes, used in medical ethics classes as an example of how healthcare workers can lose perspective. Dr. Mitchell's speech has been quoted in articles about patient advocacy. My mother called brain cancer minor. She called my struggle for survival attention-seeking. A neurosurgeon who'd saved my life drove to her Thanksgiving dinner and told the truth. The world watched. The consequences followed. And I learned that sometimes the family you choose, Rachel, Dr. Mitchell, the strangers who sent support, matters more than the family you're born into. Some headaches are just headaches. Mine was a brain tumor. Some procedures are minor. Mine was 7 hours of brain surgery. Some people deserve their medical licenses. Some don't. And some Thanksgiving dinners change everything.